The newest approaches to better health really focuses on the way the body heals itself. So my next guest provides that through an IV nutritional therapy at her clinic in Dubuque. She is Stephanie Grutz, nurse practitioner here from Balance Integrative Health and Wellness. I'm so glad you're here today, Stephanie.
Thank you.
Because I think what you're talking about is something most of us have never heard of, although you told me it's not brand new.
No, it's been around for a long time. I tell people, you know, on the East Coast and West Coast, they've had this for years, and now we're just kind of starting to adapt to it in the Midwest.
It's getting mega vitamins or supplements through an IV, not through pills or liquid. And how is that better? What's the benefit of that?
So when I was diagnosed with Crohn's, and I didn't feel like I was getting nourishment. So I was like, how can I get nourishment without having things go through my gut, which is in damage right now? So I went and got trained in the West Coast and brought it back. So IV therapy just brings nutrients right into your cells without having to be processed by the gut.
Well, as a nurse practitioner, you could administer this.
Yes.
And it is an IV. It involves a needle.
Yes.
You get hooked up to this. And you told me that you treat a lot of cancer patients.
Yeah.
People who are going through treatment.
Yeah. So, you know, I brought it to my clinic because, you know, figured if it could help me, it could help people like me. But then I started having cancer patients call, and there's a lot of studies. University of Iowa has done a study about high-dose vitamin C in cancer care.
I have heard that.
Yeah. So we do high doses through the veins. It's very safe, and it helps people when they're going through chemo, radiation, surgery, just repair without all of the harsh side effects.
Well, it does make sense, Stephanie, even for those of us not medically trained, that when all these high doses of vitamins or anything we put into our system has to go through our digestive system. And a lot of us have compromised digestive systems because of toxins and disease. And your Crohn's, how's your Crohn's doing?
Good.
Yes.
Yes.
It's a painful thing, isn't it?
You know, I don't wish it on anybody, but it's something that I'm blessed with because I have what I have now. So
yes, and you're helping others.
Yes.
So these pictures we're about to look at is that how you administer?
Yeah. So you know, you're in a comfy chair. It's a nice, quaint room, and you know, it's just other people. It's nice. We don't have TVs in there, so people interact with each other, and they all have unique stories. So it's fun to.
So it's an infusion, was what I guess the word we could use, right?
Yes.
And how long does it take?
So typically, it just depends on what people are getting, but 45 minutes for a basic nutrient IV, and then an hour and a half for a high-dose vitamin C.
How do you decide what I'm going to need, Stephanie? If I come to you and say, hey, I want this, well, I'm sure there are different kind of cocktails and stuff, right?
So I really customize it to the patient. So, you know, if you came in and you told me that you were having migraines, then I would give you different types of magnesium. If you were an athlete that just got through a race, I give you a wellness bag.
We're looking at the chamber now. Tell me what that is.
So with Vive IV therapy, we also have a hyperbaric oxygen chamber. So that brings in pressure and oxygen, and it helps promote oxygen and stem cell production through your body. So you're just getting all of those nutrients that you just got with an IV are just getting absorbed into your cells.
Can you tell me about a little bit about the cost involved? Because I'm sure folks are wondering, this probably isn't anything that is covered by insurance.
Yeah, unfortunately, not yet. Hopefully in the future they'll see it. I'm hoping that cancer centers and different places will just start adjunctively treating people with this type of stuff, and some do. But right now it's typically about $100 for a nutrient bag and about $200 for a high-dose vitamin C.
Are you, is this something you can give people in addition to the treatment they're receiving for cancer or for Crohn's disease or for these other things?
Yes.
It can coincide.
Yes.
And doctors are cool with it?
Well, you know, doctors that are open to, you know, integrative medicine. So there are tons of studies out there that show the high-dose vitamin C is very synergistic, works very well together with chemotherapy agents.
Wow. So again, if you took all of these nutrients by mouth, your body could not absorb them probably at all.
No, so we give, like for vitamin C, we give 50,000 milligrams of vitamin C. People usually take about 1,000 orally, so you're getting so much more, and our gut doesn't have to process that, so we don't get those side effects of having those nutrients.
Is it a one and done? So I go in once and you give me that much vitamin C and some other things you think I need, and then I'm like, whoa, I'm good the rest of my life? Or is this a kind of a maintenance kind of thing?
So it just depends on what you have going on. So if you just got done with a big race, you know, just having a recovery bag would be good. But some people that are just feeling depleted, I typically recommend doing a series of 4. And then if they're going through acute cancer, they do more than that, and it's part of their plan of care.
Okay.
After they're done treating the cancer, then they do maintenance so that the cancer doesn't come back.
Because that's what it is about health and wellness, is maintenance. I mean, you're never just good to go forever, right?
No.
Our bodies are always changing and exposed to new things. And so this is the Vive, IVtherapy.com. You can go there, and then the name of your place is the Balance Clinic, yes?
Yep, Balance Integrative Health and Wellness. So.
In Dubuque. Yeah. And you told me you have a lot of Quad Cityans who come to see you.
My major clientele is from about an hour and a half to 3 hours away, so yeah.
Well, thanks for what you do. And again, just like, you know, our earlier guest who made the headbands for herself, I mean, this was born out of a need that you had personally. Yes. Are you still giving yourself infusions?
Always.
Can you do that to yourself?
I do.
Do you?
Yes.
I'd like to see that. Stephanie, good to have you here.
Yes, thank you.
Thank you.